Was there a report claiming Tylenol use during pregnancy increases autism risk in children? Yes, several media outlets have reported that the U.S. Department of Health and Human Services is preparing to release a report suggesting a possible link between acetaminophen, Tylenol use during pregnancy, and an increased risk of autism in children. However, the scientific community remains cautious, and there is currently no conclusive evidence of a causal relationship. Summary of news coverage. Wall Street Journal reported that RFK Jr., currently HHS Secretary, is preparing a report alleging a potential association between Tylenol use during pregnancy and autism. The draft report also mentions folate deficiency as a contributing factor to autism risk and introduces leucovorin, folinic acid, as a potential treatment to alleviate symptoms. Reuters clarified that the HHS report is not yet published, and while it may suggest a possible link, the scientific community has not confirmed a causal relationship. Researchers emphasize that pregnant women should still consult their doctors and use acetaminophen only when necessary and for the shortest possible duration. Barron's discussed the stock drop of Kenvue, maker of Tylenol, following the news, reiterated that large-scale studies have not supported the claim, and public health experts advise caution in interpreting these allegations. Washington Post cited a 2025 review of 46 studies, of which 27 suggested a possible association with neurodevelopmental issues, including autism and ADHD. However, the authors explicitly state that causation has not been proven, and other factors like maternal infections or genetics could play major roles. Medical organizations continue to recommend acetaminophen as the safest pain reliever during pregnancy when used properly. Scientific literature and evidence. JAMA, April 2024. A Swedish national cohort study of over 2.4 million children found no association between prenatal acetaminophen use and autism or ADHD after controlling for familial and genetic factors using sibling comparisons. This suggests that previous studies may have been confounded by underlying family-related risks. 2025 Multi-Center Systematic Review. A review conducted by Mount Sinai and Harvard researchers found some observational studies indicating a possible association between prenatal acetaminophen use and autism/ADHD. However, they stress that causality remains unproven, and more rigorous studies are needed. Expert opinions. Autism Science Foundation criticized the Wall Street Journal report as premature and misleading, emphasizing that autism is a complex, multifactorial condition that cannot be attributed to a single cause like Tylenol. They warn that such claims may cause unnecessary fear and confusion among pregnant women. Conclusion. This time, there is no confirmed scientific evidence proving that Tylenol causes autism when used during pregnancy. However, due to the attention the issue has received, pregnant women are advised to use acetaminophen only when medically necessary at the lowest effective dose for the shortest duration possible and always consult their physician.
For quick, powerful reviews, don't forget to subscribe.